Hey lovers and friends, good morning to you all. Today is Wednesday. I think it's the 19th or whatever the case may be. I didn't record yesterday. It really wasn't like a lot
Turn left
going
on North Capitol Street Northeast.
But I'm headed to a physical therapist that does pelvic floor therapy, and I am going for like prenatal, I guess, treatments. A few friends have recommended to see the pelvic floor therapist. One friend specifically shared this referral with me because she ended up doing a home birth.
Exit to New York Avenue.
City life. She ended up doing a home birth, and her second time, and she said that this was very instrumental in helping her learn how to push. And I'm really trying to lead in with natural birth, unmedicated birth. So I'm giving this, I'm giving this the investment that it needs. So that's about 40 minutes away, and I think it's probably going to be like 3 appointments. I'm lying, something did happen yesterday. Let me see if this is going to be congested, but we can make it on there. So then I did have a conversation with the second doula interview, and there were some good things about them.
Red light, camera ahead.
And there was some things I was
Exit
like,
right to New York Avenue.
Y'all gonna have to be patient. I'm in this DC traffic, like y'all going somewhere. But she was just their business was very, just to me, expensive for just really what I primarily have decided that I wanted is labor support. At this point, like, I just saw a homeless person just pee on the street. City life. This is why, like, when people say to me,
in 600 feet, use the right lane to turn right on New York Avenue Northwest.
You want to move abroad to so-and-so country, isn't it dangerous? Is it more dangerous than DC? I've got a gun pulled out on me in DC. I've had my car broken into in DC. You know what I'm saying? Attempted robbery in my house in DC. I just read a note that somebody just pulled up to a political candidate and robbed him at gunpoint at a gas station. So, like, I'm sure these places are better than DC. Like, I've done my city life, like, and don't get me wrong. I mean, what comes with city life is those type of things. But when people say, "Oh, isn't it dangerous? It's not safe in those places," you must never lived in DC. You know what I mean? Like, okay. Anyway, sidebar. So talking about the doula interview yesterday, I have primarily decided I really just want labor support, because the only thing that I need, I'm about to be 31 weeks tomorrow. Plus, I have access to virtual doula, like anytime I want, unlimited. And they can walk me through like different exercises and things of that nature, which I plan to start probably doing on a weekly basis with them, like 30-minute exercises and coaching and things like that. I can get virtual support. So a lot of folks is rapping in virtual support. I really don't need that. I need to be comfortable with you the day of. So that's primarily what I need. So the first person I talked to, I really was feeling her vibes. She was familiar with pelvic floor therapy, and I also too, because I'm invested in pelvic floor therapy and learning how to hopefully push, I'm getting some value out of that. I mean, I just really need labor support for the most part. I don't need childbirth things. I'm getting that all done virtually. And shout out to my to this what's it called, Maven. This is, of course, not sponsored, but I'm really finding a lot of value being able to get virtual expertise and things of that nature. So
use the right lane to turn right on New York Avenue Northwest.
I'm not trying to spend so much money then I have to, because I'm spending so much money on the pelvic floor therapy and a lot of that virtual support that people are wrapping up in their package, I get as a part of my insurance. So I think really 2 sessions, I think having the interviews, really 2 sessions of getting to know them, them putting their hands on me and stuff like that, because even like people doing like birth plans, I'm fitting to do my birth plan on Sunday with like my virtual doula and midwife. You know what I mean? And then I'm gonna come to you with the plan, and maybe we make some adjustments, but you know, that's type done. Then I'm starting GW midwife next week, because again, I'm leaning in. Okay, felt baby kick. I'm leaning in with natural unmedicated, so y'all pray for me, because I really think this is, if you don't do it the first time, I don't know why I would do it the second time. I'm leaning in with this way. So that's what's going on that front. On the work front, yeah, we talk about that in another video, for real. On the nesting front, I really procrastinate in doing my laundry. I don't know why I do that. Get that together. I'm still waiting to hear back. I need to check back on my case, make sure that they got the money, because I haven't heard anything from my tenant, and I'm going back and forth on if I say something or not, but just let the law speak. I think I might just make the law speak, because I mean, I've been going back and forth with her, and she's not in a stable mind frame. So let's just see how it plays out in court. I mean, I did pay my court fees and stuff like that, and then rent is fitting to be due, and I mean, I'm gonna put that case right in too. Matter of fact, I'm gonna start preparing that case right now. Right now. So that's how my day starts. We're gonna see how this physical therapy goes, lovers and friends. The procrastination is real. Even just getting out this content, I'm about to I don't know, like, this is fit to be hard, but I'm about to like get that together, and like
in a quarter of a mile, use the left 2 lanes to turn left on I-395 South Tunnel,
and release more vlogs while I can. So all right, lovers and friends, let's go to physical therapy. That's my little update on my 30
in 1,000
plus
feet, turn left.
Tomorrow's 31 weeks. Oh, and I'm ready to go to the MFM tomorrow. I feel I was looking into, okay, I decided I was gonna go, but let me share this with y'all. I really am about to go in on the MFM tomorrow. I'm trying to prepare myself, because I don't want to be angry black woman, but I'm fitting to be angry black woman, because I'm just frustrated about all the stuff they put in my chart, did not discuss with me, giving me a diagnosis that is, to me, very much incorrect. And my child, my baby is growing. She's not growing on the scale that they want, but then I go and look up growth scales, and
turn left on I-395 South Tunnel.
I don't know what they're looking at, because I'm looking at what's publicly available via NIH and other child things around estimated fetal weight, and
speed
she's
camera
there.
reported ahead in 1.3 miles.
She's
Keep
there,
right
you know what I mean?
I-395 South
And
Richmond.
something that they said is that they could be on their own growth rates. So I'm really like, don't appreciate them giving me a diagnosis, recommending induction, and not even discussing that with me, like at 37 weeks. Like, I can see if baby was in distress, but she's not in distress, and she is growing, but just not growing at their rate. And there's something called small for gestational age. She might just be like like the 2 doctors ago said, just, you know, I might just carry small and she might just be small. And her father was small. I've had every genetic test done that I could get done that's non-invasive. And I'm just, so it's not anything like genetic abnormality or anything like that. At least that is a very low chance of that. So yeah, I want them to update my information to properly reflect what has been discussed with me, what my quote unquote, what the recommendation is.
Use the right 2 lanes to keep right.
Because I'm carrying that chart with me. Ooh, sorry y'all. I'm carrying that chart with me until, you know, it passed over to GW. And I don't want any issues with me trying to do a natural birth. Or let me say, leading with a natural birth. If the baby decides to come early, you know, I have to deal with it. That's not really what I want, but it's not about what I want. But I know one thing, like, she ain't in distress in the womb, for sure.
Keep right to I-395 South Richmond.
And I was talking to my sister, and I'm just getting like, they're not looking at my case in the wholeness, I feel, and really rationalizing it.
In half a mile, use the left 3 lanes to continue on I-395 South Port Richmond.
God. I know y'all tired of that. IVF babies tend to be smaller. Black women tend to carry smaller. If you want to be looking at statistics, I don't have preeclampsia. I don't have gestational diabetes. I've gained 20 pounds thus far. So I'm in the recommended window. I know 195 was like so deep when I saw that. I was like, one thing I was told myself, I did not want to get over 200 pounds. Woo! Lord, but I didn't start from a good place. But anyway, ooh, this person about to hit the shit out of me.
In 1,000 feet, continue straight.
I know they mad. I'm trying to get over. What time is it? It's a lot of people on the road. This is how COVID's spreading. So I'm just getting ready for that conversation tomorrow. Get my 3D joint and then be on my merry way. Be on my merry way, because I just have to trust. I just trust myself. I'm so firm in this. Like, I'm unwavering in this. You know what I mean? And I know my body knows what to do, and I know that she is fine. You know what I mean? Like,
continue on I-395 South Port Richmond.
I know she's fine because I'm fine. I'm fine. So I don't know what they're looking at. And just a case in point, like, my friend just delivered her daughter.
Use the left lane to keep left to I-395 South Express.
Oh, no, we're not going that way. My friend just delivered her daughter. You know, 2 days before she delivered her, they said the baby was 8 pounds. She's 7 pounds. She came out 7 pounds. So, like, that's just like, yeah, y'all know what y'all talking about. Y'all do not know what y'all talking about. So, anyway. All right, lovers, friends. I need to pay attention and drive, so I'll pick y'all back up. Good morning, lovers and friends. Happy...
In 1,000 feet,
oh my
turn
God,
left.
what's today? Yeah, today's Thursday. Thank goodness. Another day, another doctor appointment. This the doctor appointments I'm fitting to really get into their ass as gracefully as possible. I've had a few frustrated expressions, so hopefully I can express myself, and they really just update my chart to reflect, to be accurate, and you know, around what's going on.
Turn left on I-395 South Tunnel.
I did not sleep well. I thought I was sleeping
camera
well.
reported ahead.
I thought I was sleeping well, and then I was like, okay, bet it's probably like 7 a.m. or something like that. But it really was like 4 a.m. So I was up, and I just could not go back to sleep.
In 1.3 miles, keep right to I-395 South Richmond.
I just couldn't go back to sleep. And then I was like, well, let me shop, because I really want to get my baby shower folks. I already have like probably 90% of their gift for the folks hosting my baby shower, but there's something I want to get them that I'm trying to figure out pretty much how to get them. I may not be able to have it all at once, but I know one thing: I'm going to be ordering this weekend their shower or thank you gifts, I should say, because I would love to be able to present them to them at the shower. So I may be missing that element, but let me see if I can kind of find it. All in all, I'm just going in here. I really am not nervous because
use the right 2 lanes to keep right.
To me, the goal is for baby to be 3 pounds. So I'm hoping that they take the weight today. I'm going to request that they do. Sorry, I'm in this tunnel. I'm going to request that they do. So if she's 3 pounds or close to it, I'm pretty happy because I still have, you know, two plus months left, and I think most of the weight gain is going to happen at the end.
Keep right to I-395 South Richmond.
She's continuing to kick and move pretty often, I would say. I'm not really like kick counting or anything like that, but I'm just paying attention that I felt her move.
I-395 South Port Richmond.
Sorry, y'all. I'm just paying attention that I felt her move in the last, like, you know, couple hours. But that's that. We're gonna go in here with positivity. I just feel so strongly. I was telling my friend yesterday, like, oh my God, people, it's raining. People don't know how to get over. Throwing your signal on beach, but
in 1,000 feet.
That I just feel so strongly about this because everything is just going so smoothly for me. So and I feel really good about, you know, my baby, you know, like her health, that she's getting the nutrition because
in half a mile, use the left lane to keep left to
why would I think anything else? This is a blessing. This baby is a testimony. So Dave didn't stress me out. The pelvic floor therapist yesterday was pretty interesting. Y'all, pretty interesting. I've never been to any
keep left
type of physical therapy before. Okay, I see where they're trying to make me go. I ain't going that way. I've never been to any physical therapy before, so it was really enlightening about, like,
keep left to I-395 South Express,
your pelvis and how to push. And it really went along. Yesterday I also had my childbirth class, and it also kind of went along with me viewing my childbirth class, which, you know, they're doing all remote and things of that nature. So I feel between that, me watching videos on YouTube, I kind of am getting a feel for it, and I'm really like starting to prepare for birth. So starting to get a game plan for birth, even though I haven't really spoken to my midwife yet, but you know, leading with natural, and I think I can do it. I'm going to try to do it and things like that. I'm just going to try. Like, I'm going to try my best.
Half a mile, use the right lane to exit to US 1 South.
But we also had to look at the look down there, and I had to look down there in a minute. I ain't going front. I haven't been down there in a minute. I've been taking care of her. She's nice and clean and stuff like that. But I haven't taken care of that. But one of the things they mentioned is doing this
in 1,000 feet,
perineal massage, which I'll start maybe in
exit
like
right to US 1 South, I-395 South. Then use the right lane to take exit 8B, State Route 110 North to I-66 West toward Rosslyn.
Y'all just know exactly where I'm going, don't y'all? Yeah, so we'll start doing that. But in other news, I'm just trying to make it
use the right
to the
lane
end of
to
the
take
week.
exit 8B, State Route 110 North to I-66
Waze is
West toward
killing me, right?
Rosslyn.
It's killing y'all too. I'm just trying to make it. Anyway, what I was trying to say is I'm trying to make it to the end of the week. I don't know about y'all, but like me not working is imminent. It's like that. coming fast enough. I probably should have went a little bit faster, but it's all good because probably that last week I ain't really gonna work anyway.
In 1.9 miles, exit to I-66
if
west
I have my
toward
way.
Front Royal, Dulles Airport.
If I have my way. So yeah. And today I have like an important business meeting, virtual of course.
Police reported ahead.
Oh shoot. So that's why you have ways. Where's this Popo's at? They ain't finna get me. It's raining outside. I ain't got time for that. I don't got any time for that. Oh shoot, here they come. Here they come. Yeah, I have an important business meeting today. I hope they gravitate towards and get excited about what I'm trying to present to them today. And then I'm still working on this RFP. And then I decided with my parents' invitations, like I just did not for some reason feel motivated to like type up everyone's address and have it mailed on my behalf. So I didn't think about this option of just having them mailed to me and then I can like write on them. I should have did that 2 weeks ago. And just also too, it's probably good to have extras in case we need to mail any last minute. So but you know, I don't feel too bad because everybody I reached out to, I sent them the link to it, so they, you know, to it, they just not hip to technology, a lot of them. So anyway, it's not like this is the first time that they're gonna be hearing about it on the 19th. I do want to send out a note. I'm gonna talk to my baby shower people, send out a note about send out a note about the dress code, because a couple people have asked me, and I'm trying to figure out. It's been such a long time since I partied, but you know, brunch, daytime party, day party vibes. Hopefully it's going on. I'm just really hoping that the weather is decent that weekend. I also am happy that I chose a weekend with
exit right to I-66 west toward Front Royal,
extended
Dulles
holiday.
Airport.
So I think that Monday is President's Day, and I would say a lot of people have that off. Hopefully, I think I get that off. If not, I'm taking it off. I'm taking it off, but that's what's going on that front. I'm still fronting on doing my laundry. I have somebody coming to stay today in the basement, but
continue straight for 7 minutes to I-66 west.
All right, lovers and friends, I'm gonna catch up with you after this appointment. We shall see how it goes. Lovers and friends, today is the 20th and it's the evening time, and I never got back to you all to tell you how my doctor's appointment went. They're very, very strict in the testing center around cameras and phones being out, and so I didn't even try to risk it because already y'all know I was going on in there and I was gonna be on one. First of all, I hate waiting, and every time I have an appointment, it's a good 30-minute wait before, 30+ minute wait before I end up going back. So that was pissing me off. But you know, this time I didn't sit idle. I started to edit videos. I just wish I would have brought my headphones, but you know, I just had the volume low to do that. Lo and behold, the one stenographer that I really, really like, which is this gentleman named Greg, shout out to Greg, is the one who was doing me today. And I asked him before, when I was going back, I was like, what are we doing on today? Because I purposely didn't go last week because I was like, the fuck for what? I just, you know, want to go when it's like they're doing the estimated weight. Because the biophysicals, like, I went to my OBGYN. So anyway, he was like, yeah, we're going to be doing a little bit of everything today. So when we get back to the room, I say to him, I said, hey, do you mind if I connect with the doctor after this? Because I have some concerns. And he was like, sure, you know, you know, you may have to wait a little bit if you want. And I was like, yeah, that's what I want, because I have, you know, a few concerns. He was like, was there anything I can address for you? I said, well, yeah, you know, every time I come here, I hear something different from the doctor. They have written down that I have fibroids, a recommended induction, recommended medicine for preeclampsia, even though that doesn't help with the baby's weight. You know, and these things are in the notes in the chart, but these aren't what's discussed with me, you know, in terms of when they're doing the wrap up meetings. And I've gotten a second opinion and things of that nature. And he was like, well, you know why you're here? And I said, yeah, because y'all say the baby is measuring small. He was like, well, you know the baby is measuring small. And I was like, yeah, measuring small, but you know, to recommend induction and for my OBGYN to say 37-week induction, you know, when the baby is not in distress, I don't have any signs of preeclampsia, and I don't have any fibroids. So he was just like, well, look, I'm not a medical sonographer, so I'm gonna tell you, you know, my role in this. And he was like, you know, when you came in for your 12 weeks, I did it, and I did see a really small fibroids. Sometimes people see it, sometimes people don't, you know, type of thing. And I said, well, that's different than me reading in the notes. It seems like they're recommending induction and having growth restriction because of a fibroid. And I was like, and he was like, okay, well, that's not the case. You're absolutely right. And I said, you know, he goes on to make me feel better, because one, I already like him, because he's a thorough sonographer. He has a great spirit around him. You know, if I could get him consistently, we probably wouldn't be in this situation. But that's not the case. So he goes on to tell me, he was like, well, look, there's obviously a breakdown between the MFM and the doctor. He said all of these are just recommendations. They're going to go from one extreme to, you know, to the other. That's really their job. And then, you know, I commented him. I said, I feel like I'm being treated like a statistic and not really based on like what we see here. And he goes, well, you know, they have to use a level of standardization. You know, not everyone fits on that. He said your case may not fit in that, but, you know, that's where they're coming from. And, you know, absolutely, like, everything that we put down needs to be discussed with you. And, you know, I can definitely see why you're frustrated. But let me tell you that as a sonographer, you know, we just measure, we see things, and, you know, the doctor interprets it. And I did see this in the past. I may not see it again. The next person may not see it. It doesn't reflect anything going on with the growth restriction. In terms of preeclampsia and stuff like that, he said, I really don't have any comment on that. But let me just tell you today, like, you know, we want, you know, to get the, you know, the baby's weight and see any concerns. He did says, you know, like, he goes in to say, like, the real deal is, like, we know in healthcare in America, a lot of the care we get isn't care. It's coverage. It's CYA. And these doctors go to extremes or treat you to statistics to cover their ass. That's my interpretation. That's not what he said. But he goes on to talk about, like, you know, people want to get babies. They want to live in babies. And so, like, people just really are typically in this industry go to extremes to avoid anything like malpractice, anything like that. He goes on to share a story about how, you know, he's a New Yorker, so he was talking to me straight, man, which I also appreciated, about how, you know, anything can happen, and so that's why they monitor so frequently. And he tells me a story about, you know, he was checking a woman. She was 39 weeks and 3 days. She was fine. The MFM recommended induction. The OB was like, nah, that's wait till her due date. She waits till her due date. She delivers. Baby didn't make it in a matter of 3 or 4 days. And then he goes and say, you know, had they listened to, you know, the MFM, maybe the baby would be still living. But he said, but she did have diabetes and high blood pressure. And so I said, I get you. I understand that, you know what I mean? But, you know, to recommend induction at 37 weeks, that's not even full term. You know what I'm saying? It's extreme. And it's extreme when your baby is not in distress. You know what I mean? And he was like, well, it's just a recommendation, and that's how they're gonna go. So he goes on to do the measurements. In my head, I was like, if she's 3 pounds, she's good, because I still got a whole 2 months, 10 weeks, 9 weeks, not 9 weeks now to go. Excuse me, y'all. So he goes on to do the measurements. And baby, again, she passes the biophysical. She measures actually around 3 pounds and 5 ounces. But her tummy is a little small. But he had a little bit of trouble getting her tummy. He measured once, he was trying to measure twice. And, you know, the way that she was positioning, and she would not move, her tummy was a little bit like, he couldn't get like the full thing. But he took a measurement nonetheless. So he was just like, yeah, you know, she probably gets a B. She's not, technically, she's like not in the growth restriction anymore. She's just small for gestational age. And I said, yeah, that's fair. That's what I really believe it is. She's just small for gestational age. And I said, you know, if you want to talk about statistics, IVF babies are smaller. Black women tend to have smaller babies. And her father was smaller. Was a small baby. So he was just like, yeah, you know, maybe you just make small babies. Cool. It's a different conversation. So he walks me out after he takes all the measurements and tests. I go meet with the doctor. This time the doctor pulled me in his office. I was like, okay. It almost felt like I was going to detention, y'all. Like the principal's office. Like, did I do something wrong? But this time, this doctor really was like, I said, you know, I was concerned. He talks through everything that's on my chart. He was like, I'm typing it up right in front of you. I'm sending it to your OB. Here's a copy type of thing. And then he said, you know, right now, you know, based on the baby's measurement, she's in the 15th percentile. So that means she's not in growth restriction anymore. She is, you know, growing weight. And you're right, you know, there's no levels of distress or anything of that nature. So right now, she can't be diagnosed as that. She is just small for gestational age. And her stomach is a little at the 11%, so she's just above saying it's growth restriction. So he was like, you know, come back next week, and, you know, we go from there. But really, we'll probably honestly check you at 34 weeks, and then really check you again at 37 weeks. But we really won't know about induction until 37 weeks. Y'all, I'm hell-bent on not delivering early. Unless she's in distress. But no. No. I'm not going that way. The earliest I would do is 39 weeks plus 3. That Sunday. Because I want her to be a spring baby. And I don't mind her being born on Sunday or that Monday as well. Before or after the 24th. Type of thing. So, I don't know. I'm just going to see how it goes with talking to my midwife next week. But, I mean, let this be a lesson about advocating for oneself and just asking questions. And so, you know, one of the things he said was like, you should be able to ask your OB anything. And the reason why, and I'm glad I'm switching. The reason why I didn't really feel comfortable is because I didn't you don't meet your OB when they do these practices. I've been with a nurse practitioner this whole time who I like because it's consistently been the same person, but you don't really meet the OB until the 3rd trimester, and I had just started my 3rd trimester. I never met this woman a day in my life, so who am I asking questions to? Who am I asking questions to? Like, I don't have a relationship with them. And for the MFM, it's always been somebody different as well, and there was no way to reply in the portal to ask questions. You know what I mean? about what I saw on my chart versus what was said. That's not good, but I'm happy I'm switching. You know, I got a good state of mind about baby. 3 pounds 5 ounces. So really in my head, she got like 2 more pounds to go. And you know, that'll put her like 5.5, you know, 5.5, maybe 6 pounds, and we happy with that. We happy with that. So alright, lovers and friends, let me go. I didn't sleep well last night. I'm about to just do my little nighttime and go to bed, but yeah, doctor's appointments. I'm cool.